Well, let's back up on the history of TMS. When I was in residency, I remember in 2009, the main training I got on TMS was a doctor in Scottsdale came and talked to us about it, and she's not super. She's like, yeah, this is kind of an interesting treatment, and I do maybe like 2 a week and at most, or maybe 2 a month, two patients a month. She didn't really think that it was super effective, but she's like, I guess it's something you can try. That was kind of our exposure in 2009. Now, to be fair, at that time, it was not even covered by insurance, and so anybody who's doing it was cash pay. It's pretty expensive. You're looking at $12,000-$15,000 for treatment, so not very accessible to most people. After 2013, when you started having insurance companies cover it, it started to gain some traction because there were more people who could do it. And that could be part of the reason that there were, like especially when I was in school and when I heard nothing about TMS, but TMS was discovered in 1985, but wasn't really. I think it was FDA approved to treat depression in 2007, 2008, around there. So it was kind of just right around that. It was after I was out of medical school. So like, why would they be talking about this experimental treatment at that time, right? So, but yeah, in terms of what does it treat? TMS currently has 3 FDA approvals for depression, major depression, smoking cessation, and OCD. Those are the only 3 right now that is FDA approved. So when we talk about TMS for autism spectrum, at this point, it's not FDA approved yet. There are a lot of studies being done, though, looking at other applications of TMS, all the way from recovery from stroke, improving symptoms after a traumatic brain injury. We've even had some success in treating people with tinnitus, so that ringing in the ears, with voices, auditory hallucinations, with depression, obviously, but also with the associated anxiety. There's some improvement in PTSD. So I'm kind of going from more obscure treatments to some of the more common ones. So I'm coming backwards. But in terms of autism spectrum, TMS is really exciting because it's something that can promote change directly on the brain that is problematic.